Mr. Gonzalez, for what purpose?
Will the gentleman yield for a couple of questions?
Please yield.
Yes, I will yield for
Thank you.
questions.
Thank you, Representative Click. There's a couple things I'd like to just kind of walk you through for the record, if you will. So we've talked about a few of these, but I just want to make sure we have a nice summation of all these conversations. Is that fine?
That's great.
Is this the medical marijuana bill?
I would say that this is a CBD bill.
Excellent. Thank you. Does your bill allow for legally smoking marijuana?
Absolutely not. It's
So there is no
ingested
leaf to
orally.
smoke, no edibles to consume, no brownies, no gummy bears, no lollipops. Is that correct?
That is correct.
In fact, your bill is for the oil only, correct?
That is correct.
With the quantities we're talking about, there is no euphoric high. Is that right?
No, there's not. That's why we've restricted the THC levels.
And this bill only applies to patients with intractable epilepsy, correct?
That is correct.
And in your bill, intractable epilepsy is defined as a seizure disorder in which the patient's seizures have been treated by 2 or more appropriately chosen and maximally titrated anti-epileptic drugs that have failed to control the seizures, correct?
That is correct.
So we're not talking about, you sometimes hear about these bogus prescriptions for stress or glaucoma. This is not that, correct?
That is correct.
The oil can only be prescribed by the patient's licensed epileptologist or neurologist, correct?
That is a requirement, yes.
And after the licensed epileptologist or neurologist prescribes it, a second epileptologist or neurologist must concur with the prescription, correct?
That is correct.
The manufacturing and distribution process is tightly controlled by DPS, is that correct?
Absolutely.
DPS has licensing approval and continuing oversight, is that correct?
Yes, they do.
Specifically, DPS will issue a license to an organization to cultivate, process, and dispense low THC cannabis, is that correct?
That is correct.
And finally, Ms. Click, DPS will also register directors, managers, and employees of each dispensing organization, is that correct?
That is correct.
Mr. Speaker, I'd like that the words spoken between me and Representative Click be reduced to writing and put in the journal. Thank you, Ms. Click, for the legislation.
Is there objection? Carries none. So ordered. The following amendment, the clerk read the amendment.
Amendment by Moody.
Chair recognizes Representative Moody.
Thank you, Mr. Speaker. Members, I first want to start by thanking Representative Click and Senator Eltife and a lot of the members that are standing here, the folks in the gallery, for working on this issue. This is something that is personally important to a lot of people on this floor, including myself. I've been part of a group trying to make sure that we have a thoughtful process, a construct that works, and one in which we can do the best for those folks, I think, that are hurting out there. I'm not a doctor. I can't tell you about the medical uses. My amendment is not a broadening of medical uses. I did have a bill earlier in session relating to decriminalization. My amendment is not that, so you don't have to worry about that. It's not David Simpson's bill either. What my amendment is very simply, it's in response. I am an attorney, however. It's in response to a legal opinion out of the Ninth Circuit dealing with specific language when we craft CBD bills. Under this bill, a physician or a doctor must prescribe. If you read the Conant decision, I have it here. If anybody would like to go over it, anyone wants to check my work, please feel free to. There's a good summary on page 6. We are subjecting physicians to danger under federal laws. We want to use the word recommend. And because in this opinion it says the federal government can't infringe on a physician's First Amendment freedom of speech to recommend these substances to be used. And so that's what my amendment does. It goes through the bill. It looks rather substantial, but it goes through the bill and strikes prescribe, and it uses the word recommends. I think it's a good answer to the problem that's created under this specific case out of the Ninth Circuit. So that way, other states have engaged in this. States like Alabama, Florida, Kentucky, and Wisconsin have used the prescribed language. Other states have used the recommend language. The ones that have used the prescribed language have had a little bit of a chilling effect on the use of this structure. I will say this, the bill as is something that I support today and will support no matter what happens with this amendment. This is my attempt to address a specific legal concern that I have, and it's one that I think and I hope that we're all keyed in on, because this is about functionality for those families that are suffering and that we're trying to help. This is the Compassionate Use Act, and so I want to make sure that we can actually use it properly, and that's what this amendment is about. I don't know. That's fine.
Chair recognizes Representative Click in opposition.
Sure. We have been working on this legislation for the last 18 months and have had other folks that have talked about changing it to recommend and prescribe. And we are treating this product as a medication that is prescribed by a physician. We've ran this by several other legal authorities in our drafting and do not feel that there is a need to make a change. So, I moved to table.
Yeah.
Mr. Moody, for what purpose?
Will the gentlelady yield for a
Ms.
couple
Click,
questions?
do you
For a
have
couple of
question?
questions.
Lady
And so
yields.
this specific amendment strikes prescribe in all places in the bill and inserts recommend. And you said were you aware of the Conant decision? Did you go over that?
Yes, I have.
Okay,
And
what
I-
was the, and because my reading of it, and again, I said I'm not a doctor, but I'm a lawyer. My reading of it is that the federal government can still initiate investigations based on prescribing, because that counts as aiding and abetting. And that's the way I read this opinion. Is there some other opinion out there that I need to look towards other than this?
One of the other things that you need to look for is the U.S. Congress in December passed legislation or an amendment in the omnibus bill that said any state that has got a permissible framework for the use of these substances in their state, that the feds are not going to pursue any criminality.
Can you explain then why some other states that have, and this is a broad discussion going on in lots of states, and I applaud your efforts because it's important to have this discussion in Texas. And I am so glad that you're carrying this, and I'm so glad that we're doing this in the Texas legislature. But I have this specific concern. I want to make sure that we protect people the way that we can, because the words do matter in law. And so when these things go up, depending on the administration or however things are going to go at the federal level, we want to make sure we afford the greatest amount of protection possible, and so that's why I offered this amendment. Can you explain then why there's still an issue in some of the states that use prescribe language and didn't use recommend? Have their problems been remedied by what you said happened in D.C. last year?
I'm unaware of any problems in the other states. This amendment was passed back in December.
Okay, I appreciate your work again. Thank you so much for your consideration.
Mr. Coleman, for what purpose?
Ask a quick question to follow up on
Ms. Click, do you yield?
Representative.
Sure.
Lady yields.
Representative Click, just following up on the question of challenges in other states with the law. We heard no testimony in committee that folks who had gone to Colorado or knew of family members or others in states that there was a criminal aspect to the use of the oil. Is that correct?
That's correct. The one requirement is that they cannot bring it across state lines.
So there's no one prosecuting individuals who use the oil in a state that's passed the law for that to be legal to use to reduce the number of seizures for that person, for the child.
Not that I'm aware of.
Not that you're aware of. And so as far as we know from the hearing, that wasn't the issue at all. As a matter of fact, we didn't see any issues. And there's a trial being done at Baylor College of Medicine. Is that correct?
It's actually, there are a number of facilities that are involved in that.
Yeah, Children's in Dallas, I think, is involved in that. And so we also heard a lot of testimony about good results from the use of this oil that really improve the life of the child, the parents, and otherwise. Is that correct?
Some of the children have actually become seizure-free in using this product.
You have a good bill. I'm proud to be a joint author.
Thank you. Table.
Chair recognizes Representative Moody to close.
Thank you. I know we've been on the floor a lot longer than we expected, and I appreciate the conversation. Like I said, I've tried to bring a functional conversation around these issues all session, and this is just in furtherance of that. The case law is pretty clear on this issue. I want to make sure that we protect our doctors who are going to use this good structure that's being laid out in Senate Bill 339, make sure there's no fear there, and they have an absolute First Amendment right to recommend, and that was laid out in Conant. So you know as well as I do, administrations change in D.C. Why leave it to chance? And so let's make sure that we have this language as part of the bill so that it is something that we don't leave to chance, that we are making sure this is going to be functional the day that it is signed by the governor. I ask you to vote no on the motion to table.
Representative Moody sends up an amendment. Representative Click moves to table. This is on the motion to table. Clerk, ring the bell. Show Representative Click voting aye. Representative Moody voting no. Show Representative Zerwas voting aye. Representative Howard voting aye. Have all members voted? Show Mr. Schaefer voting aye. Have all voted? Being 99 ayes and 32 nays, the motion to table prevails. The following amendment, the clerk read the amendment.
Amendment by Moody.
Chair recognizes Representative Moody.
Looking at the board, I have a prediction on how this one's going to go, but I want to have this conversation. So what this amendment does, since we want to make sure prescribe is still in the bill, this amendment leaves that intact, and it adds at every point at which prescribe is put in the bill. It says or recommend, or recommending physician, or recommended. So we're just, instead of taking the language out and swapping it out, we're adding recommended so that they're both in the bill. I understand the reticence to remove prescription or prescribe and add recommending. So in this way, I think everybody is covered. We're not eliminating prescribe. We're putting recommend in there. That's very clearly under the purview of the First Amendment in terms of the physician's rights. And so this doesn't do damage to the prescription language in the bill. It just adds the two together. And I think that's a good way to compromise this discussion, and one in which we make sure that this is functional when it moves out of this building into the hands of doctors and patients for them to use. I'd move adoption.
Chair recognizes Representative Click in opposition.
Again, this is an amendment that I am going to ask that the members table. We are getting very late in the session, and we need to do something to help these families. And I'm afraid that anything that we might do in delaying the progress will place the legislation in jeopardy. So I would move that members vote to table.
Mr. Speaker.
Mr. Moody.
Will the gentlelady yield for a couple questions? Will the lady yield for some questions?
Yes.
Ms. Click, lady yields.
When you say it's going to place it in jeopardy in this process, this is just an amendment on the House floor. We have every right to bring forth amendments to try and improve bills. As an attorney, I see an issue that I think can be remedied here. I understand the discussion that we had on the First Amendment, which eliminated prescribe. This amendment doesn't do that. It just adds the other language in. So what damage does this do specifically? I don't understand.
You know, my agreement with the Senate sponsor is that we would keep this bill clean and free of amendments. And as I discussed earlier, I don't see the problem with the term that are currently in the bill.
Well, and if there's no problem with it, then this doesn't do any harm either. And that would be my point. It's additional language that affords additional protections to the physicians that will be working in this arena under your bill. I know this concern has been brought to you throughout the session. I know that the concern was brought to the senator. You know, with all due respect to the Senate, we get to decide what the policies are here on our side. And you know, I understand the concerns about about debating in this arena, but we should have the opportunity to rectify or remedy something that we see as a problem. And so, I'd be happy to work with them at a later point, as I always am, but we have the right as our own legislative body to try and fix things to make sure they're functional in the right way. The way in which the people outside of this building think it's going to work, we have the obligation to them to make those decisions as a body ourselves. And so, again, I appreciate your work on this and have the utmost respect for the time and the attention you've paid to this bill. And I hope we can continue to work on this particular language, because I think it adds belts and suspenders, even if you're correct in that it doesn't really do anything, or that law doesn't really curtail the usage. Then this should be an acceptable.
Table. I move to table.
Chair recognizes Representative Moody to close.
Thank you, members. I appreciate the time and attention. I'll leave it at this. This is an issue that I've worked on all session. This is an issue that I'm trying to bring a sensible construct to, and one that I think is so important, and I know that a lot of people have worked on. This is an issue that has not been addressed at any point in the process yet, and so I'm trying to raise your awareness to this, in that because when we walk out of this chamber, and if this bill goes into law, and if it doesn't have the impact that we've told the folks that are outside this building it's supposed to have, because I've heard them testify in our committee, the suffering that these families are enduring is profound. And if we pass a bill, knowing that we could have passed it in a more functional way, and it doesn't help the folks outside this building, then that is not compassion. It means that 2 more years are going to pass before we get something that's functional. This is our opportunity to change that. I have great respect for this effort. I'm going to vote for it no matter what happens on this amendment. But this is something that we have the opportunity to do as a House, and I ask for your consideration on this amendment. If the concern that I'm raising doesn't really exist, then this amendment doesn't affect that. So what's the harm in adding this language to the bill? And I'd ask you to vote against the motion to table. Thank you.
Mr. Moody sends up an amendment. Representative Click moves to table. This is on the motion to table. Clerk, ring the bell. Have all members voted? Show Mr. Stickland voting no. Have all voted? There being 98 ayes and 33 nays, the motion to table prevails.
Mr. Speaker.
Mr. Keogh, for what purpose?
Gentlelady yield for a question.
In just a moment, we lay out the next amendment. Members waiting for an amendment to be drafted.